Health Watch 3 reporter Eileen Corey tells us how doctors are getting better at treating this virus that causes such painful problems. Here's Eileen.
The pain of shingles can be so intense and so lingering that some patients report thoughts of suicide. So when Connie Bergman broke out in a shingles rash and mentioned it to some friends, she was scared by what she heard.
They said, you just have to learn to live with it. Several of them had not gotten any medication, and now we're still in pain with it. And I didn't realize it lasted beyond the period of being broken out, and so that really frightened me when I knew I could feel like this for years.
No way, because Connie's doctor acted quickly, sending her to specialists at university hospitals where research is being done on new treatments for shingles. Treatments that are most effective when symptoms first appear. The intense pain on one side of the body that develops into a chicken pox-like rash. If patients are seen within the first 3 days of this rash, when the herpes virus that causes shingles is most active, they can get into a free study of a new drug.
The feeling is if it's used early enough, it can prevent the virus from reproducing and will then shut down the rash before it progresses to become more extensive or more painful.
As part of the study, patients like Connie will receive either acyclovir, an antiviral drug, or a new, more potent version of it. Acyclovir is expensive, $200 for a 2-week supply, but as part of this study, it is free to patients. The only catch, 17 pills a day.
But you do drink a lot of water in order to get 17 down.
I'll bet.
But aside from that, it was no problem.
And after a few days, there was no pain. Unlike many other patients who delay treatment, for Connie, shingles is just a bad memory. Eileen Corey, Channel 3 News.